So the next theory that we will see now is Jean Piaget's theory, which is the Jean Piaget cognitive theory. So according to Piaget, the following mechanism helps the child to progress from one stage to another. So basically, Piaget, he has given a cognitive theory. Cognition is the process of thinking. So Piaget has basically given a theory which helps us to understand how thinking develops. So Piaget believed that how this thinking develops, it can be divided into various categories. So firstly, there is something called as operation. Operation is any action which a child performs mentally, and this action is reversible. Then there is something called as schema. It represents a dynamic process of differentiation and recognition of that knowledge. Then there is something called as assimilation. Whenever a new object is interpreted in terms of idea or action, the child has already acquired. So this is what is called as assimilation. Next, there is something called as accommodation. It is the individual's tendency to modify the assimilated data to fit a new situation. And lastly, there is something called as equilibrium or equilibration. This is basically the state which is between assimilation and accommodation. It is the state which is established as new knowledge to the child. This is the result of equilibration. The result of equilibration is the establishment of new knowledge. So let us consider this with an example. So what is operation? Firstly, operation is any action that the child performs mentally. So for example, let us consider a child who is sitting on his window. So what happens is the child sees a buffalo. Now this action of seeing the buffalo or the data, this is what is operation. And this action is what is performed mentally. The action of thinking, the action of anything which can be performed mentally is what is operation. And this is reversible. Next is schema. Schema represents a dynamic process of differentiation and recognition of knowledge. So let us consider the same example that the child was sitting on his window and he saw a cow or a four-legged animal. So what is schema here? Schema is basically categories of knowledge. So now when the child asks his mother what he is seeing, the mother tells that it's a four-legged animal. So that is the schema. It is the category of the knowledge. Next is assimilation. Now let's take the similar example. Suppose that the child is now sitting and watching and he sees that there is a cow walking, there is an animal in the park walking on four legs and it has got two horns. When the child will ask his mother what that schema is, the mother will tell that this is a cow. So this is the process of assimilation. What has happened is into the earlier present categories of knowledge, into the earlier present schema, the child is added new ideas. So new object is interpreted, and this is what is assimilation. Okay. uh, Nextly, there is something called as accommodation. Now let us consider the same example, but on the next day, instead of a cow, it was a let us consider a buffalo or any other four-legged animal, a dog maybe. So now when the child sees the four-legged animal walking in the park with his previous schema and assimilation of that schema, he now calls it a cow. But it's not a cow, it's a dog. So her mother will now explain to the child that since it is smaller in size, since it is of different color, since it does not have horns or any differentiation of the animal, it is not a cow. So now the child has accommodated new data into this previously present assimilated data. So what is accommodation? It is basically addition or modification of the data. So that is what is accommodation. And lastly comes the point of equilibration. As I already told you, equilibration is basically the stage between both of these two. It is between assimilation and accommodation. So after following the process of equilibration, accommodating the new data, the child has new knowledge. Okay, so this was the four processes how thinking develops according to Piaget. Next, coming on to the stages. Like Sigmund Freud's theory and Erik Erekson's theory, Piaget has also classified his theory on the basis of ages. So there are four stages. First is the sensory motor stage. It lasts between 0 to 2 years of age. Second is the pre-operational stage. It lasts from 2 to 7 years of age. Third is the concrete operational stage. It lasts from 7 to 11 years. And lastly is the formal operational stage. Now these four stages, the names of these stages basically denote what the stage will happen. So as the name denotes, the first stage, which is the sensory motor stage, lasting between 0 to 2 years. So as the name suggests, this stage is basically dominated by sensory impulses and relative development of motor things. Second, the pre-operational. In this stage, the child will not have any operational concrete data, so it is called as pre-operational. Thirdly is the concrete operational, so the child begins to have concrete operational data, and lastly is the formal operational stage. So coming on to the sensory motor stage, this is the stage which lasts from birth to 2 years of age. The infant constructs. Now all of these stages, they focus upon the development of thinking. So we are talking in terms of how the mind is trying to think. So what is happening is the infant, it constructs an understanding of the world by coordinating sensory experiences with physical actions. So as I told you, sensory and motor. So he is coordinating his sensory experiences along with his motor activities, that is his physical activities, progressing from reflexive instinctual action at birth to the beginning of object permanence at the end of this stage. So there are 2 to 3 things which you need to remember. Firstly, sensory motor. So the child will experience the world via his sensory experiences and via physical experiences. Okay. And at this stage, what happens is the age is from birth to 2 years. So the child at birth, he has got some reflex actions. Okay. And with the as this stage progresses ahead, the child develops something called as object permanence. So child born with certain basic characteristics for interacting with the environment. These primitive strategies mark the beginning of the thinking process. So it is basically stating that every child is born with certain basic instinctual characteristics, and these characteristics, they mark the beginning of the thinking process. As the child gains experience through his sensory motor impulses, the maturation progresses, these simple reflexes begin to coordinate it. So those simple reflexes which were uncoordinated, they now start to get coordinated. Permanent relating of object develops in force of coordinating actions with repeated contacts with the environment. So there is something called as peekaboo and object permanence. So what is peekaboo? Peekaboo is basically a game which you can play with the child. The first diagram here basically shows that. So since the child is smaller, his thinking is not developed. Whenever you will cover your face, the child will think that the object is gone. And when you uncover your face, suddenly appear in front of the child, and the child thinks, oh wow, the person instinctively came back. So that is what is peekaboo. Now why is this happening? The simple funda, because his thinking is still in the senses which he can see and motor which he can touch. Okay. So once he cannot see you, he thinks he's gone. Once he again sees you back or feels your hands or anything, he thinks you are back. So this is in the initial stages. That is why peekaboo game can be. Then after this, there is something called as object permanence. What is object permanence? Object permanence uh, uh, is the activity in which the child believes that an object stays there even though it has been removed. For example, to see this, you can see if you show a child a specific object, a toy or anything, and you place it under the towel, under the pillow, the child will always try to find that object under the same pillow again and again. Why? Because he believes that the object is still permanent over there. Coming on to the next stage, this is the pre-operational stage. So this stage lasts from 2 to 7 years of age. The child begins to represent the world with words and images. As I told you, now he's moving from senses and physical touches to outer things. So now he's beginning to represent the world with words and images. These words and images reflect increased symbolic thinking and go beyond the connection of sensory information and physical action. So these words and images which the child is using, they represent his symbolic thinking. So there is something called as symbolic thinking, also called as illogical thinking. which is present. Okay, and it goes beyond the connection of the previous stage, that is the sensory and the physical action. So as you can see, this stage goes beyond the sensory motor stage. So in this stage, again, it can be divided into two phases. Since it spans from 2 to 7 years of age, the initial phase of 2 to 4 years is called as the actual pre-operational stage. And the next stage, which expands from 4 to 7 years, it is called as the intuitive stage. You must have noticed children between this age group, 4 to 7 years, they want to know everything. That is why they keep on asking why. Okay, so coming on to the pre-operational stage, the primitive strategies changes. Primitive strategies means the earlier reflex actions which the child was born with changes as the child assimilates new experiences and accommodates original strategies. The child uses symbols in language with play. This is what is the meaning of symbolic thinking. Basically, the child associates with objects and he starts to use them. Okay, so the child uses symbols in language with play. There is the concept of egocentrism, which means unaware of others' perspective. And the thinking here is symbolic thinking or something called as illogical thinking. Let us come to the concept of egocentrism. So egocentrism basically means that the thinking of the child is not developed so much that he can view the world from others' perspective. There is egocentrism in his thinking. So the child thinks only that the world looks just as he is having a look at it. So the classical example is seen here. What is done is a child was placed alongside a table and the child is asked to tell what all he can visualize from this table. So the child said that he could see a mountain, maybe a cow over here. Okay, but the child could not tell about the objects which was placed far from his sight. Number one, this. Number two, the concept of egocentrism was afterwards what was done was this child was made to sit here or the table was rotated, maybe just changing the angle. And now the child was asked to tell what he could see. Again, the child said only of those things which are available over here. So this is what is the concept of egocentrism. The child sees the world only from his eyes. He cannot visualize the other person's perspective of the world. Number one. Number two, there is no concept of reversibility or conservation of memory. As you can notice from the example, if the table was turned, the child should have memorized or kept in his memory or should have been able to reversify the knowledge and tell, but the child was unable to do so. So there is no concept of conservation of memory as well as reversibility of memory, and there is illogical thinking. Another common example which is performed in these children is this example. What is done is a child in front of a child, two glasses of the same width are placed and water is placed at the same level. Okay. Now what is done? Now among these two glasses, one glass is replaced by a glass which is thinner in width and longer in length. Okay, you can see the third diagram. This glass is thinner in width and longer in length. But what is done is in front of the child only, in his vision only, this water from this glass is poured into the thinner glass. Now, as adults, we can see that the amount of water that was poured from this glass into this glass should have been equal. But when this question is asked to a child, he says or he thinks that the water in the taller glass is more as compared to the water in the shorter glass. So this is the concept of no concept of conservation and reversibility. The thinking is illogical. He sees only from his own perspective. If he thinks uh, this jar is taller, he he will just feel that the water is more in that jar as compared to any other situation wherein same water was poured. So we need to remember these things Firstly is the pre-operational stage, then the intuitive stage, and something called as egocentrism, something called as illogical thinking, something called as no concept of conservation and reversibility of data. Next, coming on to the third stage, which is the concrete operational stage. This stage lasts from 7 to 11 years of age. Now, this is the concrete operational stage, which means, and the age group, if you can see, it is 7 to 11 years. That is, the child is now going to school. So, what will happen is the child can now reason logically about concrete events and classify objects into different states. So basically, there is something called as beginning of logic formation. The thinking process now becomes logical or starts to get logical. Ability to use complex mental operations such as addition and subtraction. So before this stage, according to Jean Piaget, if you tell a child what is 2 plus 2, he will say 4. And if you say him 4 minus 2, so he will not be able to reverse those operation because there was lack of reversibility according to Piaget. Okay, and in this stage he is able to do that. He is able to do the complex mathematical operations such as subtraction, addition, reversifying the data. His now knowledge has his thinking has started becoming logical. He knows that 2 plus 2 is 4, so 4 minus 2 should be 2. So the child is, and also the egocentrism part of his thinking, it starts to reduce. The child is able to understand others' point of view. He now sees, because he's going to the school, he now has a peer group, so he can see others' viewpoints. His teacher teaches him something, he can see his viewpoint, he knows his own viewpoint, the teacher's viewpoint. So the child is now able to understand. So this is how the thinking is developing. We are moving away from the egocentric stage. Next is the formal operational stage. This is the adolescent part of thinking development. So 11 to 15 years of age throughout adulthood. The adolescents reasons in more abstract, idealistic, and logical ways. So what Piaget believed is that the thinking has developed in school. Now when the individual is becoming an adolescent, his thinking starts to become more rational. It could either uh, go into becoming more idealistic thinking. So once the thinking starts to become more rational, more logical, he could either go into becoming having idealistic thinking. Number one. Also, the child is now able to experience and see the abstract ideas of life. What are the abstract ideas of life? These include love, relationships, all those things. These are abstract ideas. Nobody has seen love, but it is an abstract idea. So that develops. So there is development of the reasoning capacity. Child is able to think more abstractly. He can imagine possibilities inherent in a problem, uses inductive or deductive logic. The logic has become stronger, so he can induce the logic or deduce the logic to make decisions to solve problems, thinks of ideas, and has a vast imagination. So the imagination also develops. So this is again regarding the sensory motor, Jean Piaget's stages. So firstly is the sensory motor. You can see the child loves to see, loves to touch. So this is a toy that he loves to see and touch. The child begins to interact with the environment, sensory motor stage, through his senses, okay, sensory and pleasure motor activities. Next is the pre-operational stage. The child begins to represent the world symbolically. So this is the classical example, a child uh, treating his teddy bear. Okay, so for him, it is just not a toy, it is a symbolic representation of maybe an individual. So there is symbolic thinking or illogical thinking, 2 to 6 years or 7 years. Next is the concrete operational stage. Also, this is the stage wherein egocentrism develops and all those things. Concrete operational stage. Concrete operational, the child learns rules such as conservation. So concrete operational is the stage where he's going to school. He now learns mathematics and all these things. So if you do the example of the glass with water with this child, this example I'm talking about, the example wherein the child was made to tell which in which glass the water is more. If you try to do it with a child who is in the concrete operational stage, maybe 6 years, 7 years, he would tell you that the water in both the glasses is of equal quantity. Okay. Next, coming on to the formal operational stage, this is the adolescent stage. The adolescent can think about concrete ideas, about abstract ideas. More importantly, he is now able to think about his own future, how he would look in the world. So sensory motor period, there is coordination of sensory input and motor responses, and there is development of object permanence. Stage 2 is the pre-operational period, development of symbolic thought marked by irreversibility, centration, and egocentrism. Concrete operational period, this is the mental operations applied to concrete events, mastery of conservation, hierarchical classification. Formal operational, mental operations applied to abstract ideas, logical systematic thinking develops. Now coming on to the dental application of Piaget's theories. So if the child is in the first stage, 0 to 2 years of age, the child begins to, as you can see, the child begins to interact with the environment. This can be used in a dental setup by giving toys which the child can touch and see. Maybe you should stimulate his sensory and motor activities of a child of this stage. So can be given toys while sitting in a dental chair or in his hand. Next is the pre-operational stage. So pre-operational stage constructivism is what is a child, you can tell this is the pre-operational stage. The child is moving ahead of senses and experiences. So the child loves to explore things. So you should let the child survey your dental chair, maybe move around it. You should let the child experiment with the airway syringe. You should blow the air on his hand and show. So something called as cognitive equilibrium develops here. Child is explained about the equipment and allowed to deal with it. You could see in the sensory motor stage, the child was very much attached to the toy. He was also, what you can do is in the sensory motor stage, you can let the child bring his favorite toy to the dental clinic and tell him if you are with him, you will not feel afraid or scared of the treatment. That is one thing which you can use. Secondly, another thing which you can use is the child associates with objects. There is symbolic thinking. So you should not introduce the erotor as an erotor to the child. Rather, you should introduce it as a whistle that blows air and water in your mouth to remove all the caries. So you should use these abstract words, animate these objects. You basically bring that erotor to life. This is called as animism, bringing life to inanimate objects. So you should associate these things with the child. You should tell that the rubber dam is just a raincoat for his teeth. So you should correlate such things and maybe increase the cooperation of the child. Next is concrete operations. So concrete operations, as you saw, the child is able to handle little bit complex things like mathematics and all those things. So his knowledge and thinking is developing. So this is the stage wherein you should go in and teach the correct brushing technique to the child, because this is the stage where you know that your complex technique which you are teaching to the child, he will be able to adapt it, he will be able to accommodate it, assimilate it into his scheme. So abstract instructions like retainer wearing and cleaning them every night, so these things can be done. In this stage, the child is very much concerned. So allow the child to hold a mirror to see what is happening inside the mouth. By this way, you can increase the motivation. If the child sees and you tell him that if you open your mouth, you will also be able to see the caries and we both will remove it, the child will help you. You should try to seek the help of the child. You should make the treatment feel like you are being helped by the child. So lastly is the stage of formal operation. This is the stage in which the child is an adolescent. So you should, he has his own thinking, he has his abstract thinking. So you should basically match to their thinking, or you should understand that at this stage, at the stage of formal operations, the child will not be influenced by what his parents are telling him. Rather, he will be influenced by what his own thinking and by his peer pressure. Next, coming on to the merits. So, the first and most important merit of Jean Piaget theory is that it is the most comprehensive theory of cognitive development. Piaget has comprehensively explained how thinking develops, how cognition, which is the act of thinking, it develops. The theory propagated that we can learn as much as about child's intellectual development from examining the correct and incorrect answers to items. So how had Piaget propagated his theory? Basically, Piaget had conducted this theory on his own children, and rather than seeing to how a child responds, Piaget basically gave them questions and saw their reaction to such questions, or gave them instances and saw their reaction to such instances and propagated his theory. What is the demerit? The first and most common demerit is that it underestimates children's abilities. Now, according to Piaget, only when a child has reached the age of 7 years, he is able to do mathematical calculations such as abstraction, subtraction, addition, and subtraction. But that is not true. So Piaget has basically underestimated children's abilities. It overestimates age difference in thinking. There is vagueness about the process of change. It underestimates the role of social environment. So by this, we complete the psychodynamic theories. Next, moving on to the behavioral learning theories. How behavior develops, or how is the character of a person defined. So first thing that will come under behavioral learning theory is the classical conditioning given by Ivan Pavlov. So based on this is also called as a stimulus response technique, stimulus reflex response technique. So based on the stimulus reflex response, an involuntary response, which is basically an involuntary response to an external stimuli, it can be described under something called as generalization. It is the process of conditioning is evoked by a band of stimuli centered around a specific conditioned stimulus. Thus, a test stimulus similar to training stimulus results in a response. Next is extinction. If reinforcement does not occur, it results in extinction of the fear. Next is discrimination. It is opposite of generalization. If a child is exposed to a clinical setting which are different, child learns to discriminate between the two clinics, and even the generalized response to any office will extinguish. So now let's come on to this is the basic three things. Generalization basically means if a stimulus is given to a child in simple terms. For example, a child comes to a dental clinic and he sees the injection. First day he will not know what is an injection, will it cause the if he does not have any previous knowledge, first day he will not know whether an injection will prick or not. So what happens is child sees the injection for the first time in his life, it pricks in his mouth, so and he gets pain or discomfort. So this stimulus of the injection is now generalized. This is what is the process of generalization. The child generalizes the sight and the touch of the injection. So now injection anywhere in the body or in any clinic around the world is painful. This is generalization. Second comes the concept of extinction. Extinction basically states that if this stimulus is not reinforced again and again, it might lead to the extinction of the fear. Let us consider this example by the same above example. Suppose the child gets an injection and he does not get the injection again for 10 years or 15 years in his entire lifespan. Now, what will happen is the prior stimulus will somewhat fade away and there would be extinction of the fear. That is what is extinction. Next thing is discrimination. Discrimination is the exact opposite of generalization. What happened in generalization is that the child got an injection, he felt the pain. Now let us consider another trained dentist who gives the injection to the child in a very painless manner. Okay, he applies the topical, he uses any technique, but the injection which was given to the child this time, it did not cause him that discomfort. So now what will happen is there will be discrimination. The child's thinking or the knowledge will now discriminate between the two stimulus, and he will now say that this clinic with this setup in this area does not cause me pain. So this is the three basic concepts, something called as generalization, extinction, and discrimination. Next, coming on to the Pavlov's classical conditioning theory. Now this is the classical example which Pavlov conducted. So what he basically did was he had a dog. Before conditioning, before doing anything, whenever this dog was presented with food. Whenever food came in front of the dog started salivating. So food here, this is all before conditioning, before doing anything. The food here is the unconditioned stimulus to which salivation is the unconditioned response. Okay. Now what Pavlov did, he is that he intervened. Before conditioning, again what he did, first he was showing the child the food. Now what he is doing, instead of the food, he replaced the food with a bell. Now what he used to do is he used to ring a bell. So bell is the neutral stimulus or the experimental stimulus over here, the stimulus that we are trying to see whether it will cause any conditioning. So it is the neutral stimulus. When the bell was rang, there was no salivation of the child, so of the dog. So the neutral stimulus, it caused no conditioned response. So there was no conditioned response. Now what Pavlov did was, during conditioning process, he presented both of these things together. He gave the food to the dog and also he rang the bell. Now, what happened was the dog again salivated because the food was present, the before conditioning phenomenon was present. So there was again this unconditioned response of salivation that was seen. After few time of conditioning, what happened was Pavlov did not give the food to the dog, he just rang the bell. So before conditioning, what was happening? Only the bell did not produce any salivation. Now if you can see, after conditioning, when the bell was rung, it produced salivation. So this bell, which was initially the neutral stimulus, it has now become the conditioning stimulus and it has produced the conditioning response. So this is the classical example given by Ivan Pavlov, the dog experiment. How you can use this in a dental setup? So the example is over here. First visit of a child to the dental clinic, what happens is the child sees a white coat. The white coat is the neutral stimulus. There is nothing which has happened. And the dentist gives an injection or maybe performs any painful activity on the child. So there is pain. So now what happens is, and when the pain occurs, there is fear and crying. Okay, that will happen in the child. So now what happens is the child has associated, if this conditioning goes on as the Pavlov's experiment, the child in the second visit, whenever he will see this white coat, rather than going through all this, he will directly, as the dog salivated on the bell, he will directly go on to have fear and crying. So second visit, sight of the white coat, which has now become the conditioned stimulus, directly the child will go on fear and crying. So this is how Pavlov's experiment is important. Next, coming on to the another theory, which is the operant conditioning theory. It was given by B.F. Skinner in 1938. What Skinner basically believed is, Skinner basically believed that the consequence of a behavior itself acts as a stimulus for the future behavior. So Skinner basically believed that whatever, suppose a child goes and does a very good job, he gets very good grades in his school, number one. And if the parent pats the child or gives him a toy for that behavior, for that getting of good marks, then this consequence of the first behavior, it will act as a stimulus for the future behavior. So the child studied hard, got good marks, the parent gave him a toy. This consequence of getting a toy now stimulates the child to do good again in the next exams, so that he keeps getting on the reward that he got. So this is what is the basis of operant conditioning. The consequence of a behavior itself acts as a stimulus and affects the future behavior. So how you can use this to your aid? So basically, there can be four consequences that you can do to a child or which a child can achieve. There is something called as positive reinforcement. Occurs if a pleasant child consequence follows the response. Example, a child rewarded for good behavior following dental treatment. So what actually happens is, a child came to you and during the first visit only or during the second visit only, the child was very good, the behavior of the child was good, you could perform what all you, dental treatment you wanted to do. So at the end of the treatment procedure, you reward the child with something, maybe anything, maybe a social smile or a pat on the back or maybe a toy, anything, you reward the child. So this rewarding process will now influence the child to do better activity or be more behaved during the follow-up dental visits. So this is what is positive reinforced. You have reinforced the activity by giving something positive to the child. Next is negative reinforcement. Negative reinforcement basically means removal of unpleasant stimulus following a response. So for example, suppose you are using an eroder for doing a class 1 cavity in a child, and during the enamel or the dentine, during the cavity preparation, the child experiences a little bit of pain. So there is negativity towards the eroder. So what you do is you do negative reinforcement. You tell that if the caries is nearly removed and if you can perform it without using the eroder, what you do is you take the eroder and keep it aside. You have now removed the negative stimulus and you excavate your cavity with maybe hand instruments or any other instruments. You cleanly excavate your cavity. So this is an example of negative reinforcement. What you have done is you have removed the negative stimulus from the child and enhanced his behavior. In positive reinforcement, what you did, you gave the child a toy or something and he behaved nicely. In negative reinforcement, something was causing him trouble. You remove that trouble away and increase the positive behavior. So that is negative reinforcement. Omission is something which is reciprocal of positive reinforcement. In omission, what you do, you refer to removal of the pleasant response after a particular response. For example, you have given the child a toy to sit with and you begin treating the child. Okay, now rather than taking up this as a positive reinforcement, the child does not let you complete the treatment, or the child is not letting you do the treatment. In this way, you can use the funda of omission, in which you take the child's good thing away from him. You take the toy away from the child. So that would be omission. You omitted the good thing. So refers to removal of pleasant response after a particular response. Example: if a child misbehaves during dental procedure, if his favorite toy is taken away for a short time, resulting in omission of the undesirable behavior. You should take away his favorite toy, tell the child that once he performs in the desired behavior, then and only then you will get the toy back. So that is how you use this phenomenon of operant conditioning over here. Then lastly, there is something called as punishment. This is what is negative reinforcement. This is the opposite of negative reinforcement. In negative reinforcement, you removed something which was causing discomfort to the child. In punishment, you introduce something which will cause not discomfort, which will basically lead the child to know that the activity which he is doing is not good. So it involves introduction of an aversive stimulus into a situation to decrease the undesirable behavior. The most commonest example of using this type of cognitive operant thinking is using of rakes in treatment of tongue thrusting habit. So what you do is you place the tongue thrust habit prevention appliance and it has got rakes. Okay, so whenever the child goes to do the tongue thrusting habit, his tongue will hit the rake. So there would be negative stimulus which the child would get, and he would know that this habit is not permitted, and slowly he will leave the habit. So basically four concepts: positive reinforcement, negative reinforcement, omission, and punishment. So what is positive reinforcement? It is adding something valuable or desirable. You give the toy a reward, a star, a toy. You give the boy, a child, a reward, a star or a toy. What is negative reinforcement? Avoiding something unpleasant. Something unpleasant was hurting the child, you have removed it. So this is reinforcement, positive and negative. What is omission? Omission is removing something valued or desired. This is omission. You take away the child's toy and tell him only after he cooperates he would get it back. And what is punishment? Adding something unpleasant. Okay. So this was regarding operant conditioning. Now coming on to the next topic, which is social learning theory by Albert Bandura. Now, Albert Bandura proposed the social learning theory. Bandura believed that the direct reinforcement could not account for all types of learning. So basically, Bandura differed from Skinner in this thinking. Skinner believed that whenever an individual has consequences for an action, then and only then he will develop his future behavior, right? If he gets reward, if he gets punishment, if he gets positive or negative reinforcement, then and only then his that will decide his future behavior. But Bandura believed that only this type of direct learning is not responsible for all types of learning. There is some amount of learning which is obtained from the society, or there is a social element in learning. So his theory added a social element, arguing that people can learn new information and behaviors by watching other people, which is known as observational learning or modeling. So he added a social learning, social element. Okay, that is why his theory is called as social learning theory. And what is this social element? It is basically the society. So Bandura believed that one does not learn from his own experiences only, he learns by watching others also. By watching others, he meant watching his peers, watching his parents, watching the society. And that is why this theory is called as social learning theory, or the watching theory is also called as observational learning theory, or also modeling. Now, how this modeling process occurs in Bandura? So he stated there are four stages of modeling. Number one is the attention stage. Number two is the retention stage. Number three is the reproduction stage. And number four is the motivation stage. So what is attention stage? Bandura stated that there are various factors which increase or decrease the amount of the attention paid. So let's take up an example. Suppose there is a small child and he has an elder brother who is just 1 to 2 years elder to him, and that elder brother dances good or knows how to dance. So the younger kid, he, uh, he could learn that dancing. He could model his younger brother, and he could learn that dancing. So that behavior can be learned. So how it could be learned? It could be learned by these four mechanisms. First is attention. So there are various factors which increase or decrease the amount of attention paid. If this younger child also likes that when his older brother is dancing, everybody is appreciating him, that would increase the chances of him observing more his elder brother. He would pay more attention to his younger brother. So that is the time of attention that he provides. Number two, retention. Remembering what the attention was paid for. If the child remembers or keeps in his memory or stores, then and only then he will be able to take up that behavior. Third is reproduction. It is reproducing the image. Only paying attention and remembering is not sufficient. The child should also do that activity or try to do the activity which will increase the knowledge about it. So there should be reproduction. And lastly, there should be motivation. This child, when he starts to dance, for an example, he should be also motivated to do it. So he should have a very high amount of, he should have a motivation or a good reason to do that act. Then and only then, when all these four factors come in play, there would be very good modeling or there would be very good social learning. For example, the child does everything, pays attention, remembers, tries to reproduce, but there is no motivation over here, then social learning theory will fail. So how is this social learning theory useful in dental practice? The most commonly way we can use is the process of modeling. So if you want to treat two children of nearly the same age group, when you treat a child who has a more positive dental behavior than the other child, he will try to learn from it. He will try to model the elder child. Always remember, when using agents for modeling, you should always try to seek children of the same age group of the child you're trying to model. Okay, suppose you want to induce this behavior in a child of 5 years of age, the model should also be a child of 5 years of age. More good chances if the model is a sibling of the child. If you want to induce a positive behavior in a child and the model which is being used to do it is a sibling of that same child, then the chances of social learning is very high. Another thing which can be used is using parents. For example, during the first initial setup, first initial dental checkup of a child, of a fearful child, rather than directly seating the child on the chair and checking him, what you can do is you can see the parents first, do their oral examination, and followed by this, you can do the child's oral examination. By watching their parents, paying attention, having retention, reproducing the same act, you will be able to instill a positive dental attitude in the child. Coming on to another theory, this is the theory of Abraham Maslow, and it is called as hierarchy of needs. So Maslow basically believed that thinking or behavior, it basically depends upon the needs of an individual, and the needs, they are classified. There is something called as basic needs of an individual, something called as psychological needs of an individual, and something called as self fulfillment or self actualization needs of an individual. Maslow basically believed that all these needs, they are placed in a hierarchical way in the form of a pyramid, and when the basic needs of food, warmth, water, rest, basically he meant that these basic needs, when only they are met, then only you can climb up the pyramid or climb up the ladder. So the basis of the pyramid or the base of the pyramid is made up of basic needs. What are the basic needs? These are your physiological needs of food, shelter, clothing. Only when a person has met these needs, he can move on to the higher levels of uh, understanding or behavior development. Another basic need is safety needs, safety, security. When all these needs are met, then the individual moves on to the psychological needs. What are the psychological needs? It includes needs of emotion, which include friendship, love, so intimate relationships and friendships. And there is prestige and feeling of accomplishment. When all these needs are met, then the person moves on to the needs of self actualization, which is achieving one's full potential, including creative activities.